Thank you so much for joining us. It's Dr. Abayomi Ajayi live, and my name is Dr. Abayomi Ajayi. Today is the 8th day of March, and therefore is International Women's Day. And I wish to join everybody in the world to celebrate women all over the world. They do a great deal for us. There's a Chinese proverb that's probably getting more than half now. And the theme for this year is gender equality. Let us create a gender equal world. And the hashtag is each for equal. We're joining them on this program to celebrate women. But you must agree with me that one area where gender equality needs to be preached is in infertility. Dr. Mahmoud Fathala of the World Health Organization observed that social burdens of infertility falls disproportionately on women. So women tend to carry a lot of burden when it comes to infertility. So today's topic is correcting the myth about female infertility. But before we can do that, let's consider what are the facts first. If you have been a regular watcher of this program, you will know that we've always said it, that men and women contribute equally when it comes to infertility. And therefore, there is no get pregnant. But of course, we know it takes two to tango. Let's look at some of the causes of female infertility, especially in this environment. And then we try to see the treatment, and then we look at the myth surrounding some of these things. We know that the commonest reasons why women might be infertile in this environment is problems with the tubes. Okay, and the major player where there are problems with the tubes is also a major part. Thankfully, tuberculosis is on the decline in this environment. I know there are still some areas where this might just be a major player, but in this part of the world, thankfully, it's going down drastically. A woman's pelvis is entered into, just like the skin, she scars. So things like appendectomy, ovarian cystectomy when you have to remove the cyst, fibroid surgery can leave scars. And therefore these surgeries, especially the ones that are not emergency, like ovarian cyst, fibroids, should only be done when it is necessary. And we keep saying that on this program. And the commonest thing is aging. People don't like to hear this, but the truth is that between the time a woman is about 30 years old and the time that she's 37 years old, this same woman, her fertility would decline by about 50%. It is physiological. So that's why we always talk about women getting married when they need to, or when they cannot get married, that they can store their eggs. Now, there's also something called premature ovarian failure, which can make a woman who is not even up to 40 to stop seeing her menses, to have what we call ovarian failure. They just do is to make sure that she's able to release the eggs. So this, once she's run out of the eggs, that's it. So there's something called premature ovarian failure, which can happen even to women in their 20s, so they just run out of their eggs. And of course, you must have heard about polycystic ovarian syndrome also, which we've spoken about so many times on this program. This is probably the commonest reason why people have problems with ovulation in this environment and in most environments. Another big player is fibroids. Yes, but I must also tell you that fibroids rarely on their own cause infertility, except when they happen to be in a position where they're blocking the tubes or they are occupying the space where the baby should stay. But most of the time also, who have fibroids usually have scars in their pelvis. There's some studies that have shown that in this environment. We don't know why that is so, but women who have fibroids tend to have more scars or additions more than people who do not have fibroids. Please kindly like and share this video on your timeline so that other people can take part in this. Now, one other cause, which is thankfully not very common, is the presence of congenital abnormalities. That is, the abnormalities in the reproductive system that somebody is born with. For example, some women are born without uteri. They don't have a uterus. There's some women who unexplained factor. Now, let's just go about the treatment of female infertility, just talking not very specific, but just generally. So we can divide this into three: the drugs, which are usually hormones, which can be in tablet form, which can be injectable. Then we have, you can sometimes need surgery, especially for things like fibroids, you know, and this can be done through open surgery or endoscopy. Endoscopy means penile surgery, and there are two ways of doing penile surgery: what we call hysteroscopy, which goes inside the uterus from the vagina to the cervix into the uterus, with 15 mm in size. So this, but also there is always the old open surgery where you need to cut open. Yeah, but it depends on the experience of your doctor. It depends on the facilities available. We're not preaching that one is better, which is probably the most effective way to treat female infertility. Don't forget, we said the tubes are the commonest reason why women have infertility in this environment. And the best way to treat tuber problems is condition. The commonest myth, you must agree with me, is that people say infertility is caused primarily by women. By now we know that that's not true. Okay, on Facebook, thank you for joining Roslyn Obasa, Adam Wachuku Olayinka Omowumi Olaya. Thank you so much for joining us. We know now that infertility is equally shared by men in male factor infertility. We've said that so many times on this program. So infertility is not caused primarily by women. At best, it will be 50-50, you know. Another myth is that people say that your best chance of getting pregnant is on day 14 of your menstrual cycle. It's not that everyone must get pregnant on day 14, because it depends on when the number of days that your cycle is. What is constant in the menstrual cycle is the second part, which lasts for 14 days. And that's, so if you're, but now it's so much easier. You can have home ovulation kits. So these are much easier kits that you don't need to start calculating anything. You can use trying to get at. And another myth is that people think that most women who are trying to get pregnant are trying too hard. And they just tell them most of the time, if you relax, this is going to happen. Well, I need to tell you that infertility is not a psychological problem. You know, so relaxation has little. What do you think you're doing? Okay? A man has low sperm count, and you're telling them to relax. To relax to do what? You know. So the most important thing is that we must know why there's a problem when it comes to infertility, and when we're trying to help them also. And that's why you see some of them, they really get upset when you tell them to relax, because probably they know what the problem is, and it has nothing to do with relaxation. Now, another myth is that people say that women who take birth control pills become infertile. That's also a myth. Birth control pills do not lead them. If there is no problem, your fertility is restored again. So there is nothing to do with that. If you take birth control pills, then you become infertile. You know, so it's also a myth. Then also they will tell me that they've seen 70-year-old men who have fathered children. True. But age affects men as well as women. Yes, in women, it is so acute, or it is so pronounced that a woman can run out of eggs. All right? But the thing is that fertility in women starts decreasing from about age 27. But it's not clinically evident until she's about 35. Okay? And then at 37, it takes a major hit. At 40, it becomes urgent. Volume can decrease, motility can also decrease. So you see that even when older men marry younger women, the time to pregnancy it's longer because there's some changes also that take place in men. Though men never run out of sperm like women, all right. Also, there's something we call DNA fragmentation, which also happens with age in men. This also that's why it's common for even when young women marry older men for the children to have congenital abnormalities like Down syndrome and the rest of it. So it's not only women that age affects; it also affects men. But like I said, it's just more acute in women. Now, another myth is that people say if you already have a child, you don't have to worry about infertility. There is nothing that can be more false than that because we know that there is something called permanent. If it's looking for the fifth and it's not coming, it's still infertility. Don't forget the definition of infertility is inability to conceive after 1 year of trying. So even if you have had a child before, it's possible even because of the management that went with the child. Either you delivered either vaginally or through cesarean section. There's maybe the something was not well handled. It's possible for you to have infertility, and that's why once you are you're trying to conceive and you cannot conceive, and you know you still want to have more children, it's better that you go and for proper evaluation and assessment, so that we can always know what to do in your own particular case. What I'm trying to say in a nutshell is that we should understand one thing because that's what some of the things that some of our people do. Because somebody has gone to the doctor, a particular drug has been prescribed for him or her, and then you start swallowing the same drug. Your problems might just be different. Okay? And that's what a good doctor will try to do is find out what your problem is and try to see how to have tailor-made treatment for you. So don't there is no one size fits all when it comes to infertility. Another myth is that people say fertility problems begin at age 35. That is so far from the truth as well, because fertility problems can occur at any age. You can be 25 years old and your T tubes are already blocked. And so if you are waiting until you are 35 before you start investigations, you will have lost 10 years. During which, if you listen to me earlier on, I said between when you are 20, when you're about 30, and when you are 37, your chance of getting pregnant. And therefore, at any age in which you are not able to achieve pregnancy, it's better that you start your evaluation. If you are less than 35, if you have waited for 1 year, if you are over 35, 6 months is what you need to wait for, and you start the investigation so that we can immediately see what to do and see how to solve the particular problem. So we don't have to wait until you are 35 before you start seeking help for infertility. Now, another myth is that people call me a lot and talk about irregular periods and one of the things they say is that because they're not menstruating on a particular day of each month, they want to walk like the clock. I see my period on the 4th. Hey, come on, it doesn't work that way because, and then you say, some people will say, oh, my period is irregular. You ask them, what do you mean? She says, oh, some months I see it on the 2nd, and then that same month I still see it on the 30th. And I say, hey, wait a minute, there's nothing wrong with that, because when we talk about menses, your period, we're talking about, yes, some people have 28 days, but 21, and you don't need to worry yourself about that. You don't have to be on the 4th of every month or the 2nd of every month. Very few people are that lucky. So don't worry your head over some things that they're not problematic. Oh, maybe one other thing I need to talk about this thing is this prolactin. I see a lot of women, they're always on bromocriptine or one of these derivatives. And they say because they've done their prolactin level and their prolactin level is high. I want to tell you that prolactin, that's one of the myths also. But even taking a meal can make your prolactin to go up. If you come in from the traffic and you do your prolactin level, it's going to be high. But We don't treat test results. What we treat is human beings. So what we ask, if when you milk is not coming out of your breast when you are not lactating, what we call galactoria. Yes, if your prolactin is a little bit on the high side, we don't treat it. All right, but if we think probably, and at that level it's going to affect your menses, that the level is very high, like some people say above 80, some people say above 100, then you might have to investigate why that prolactin is that high. But I see people with 30 and they have been on menses is regular, there is no galactoria. For the sake of Christ, please stop using all these drugs indiscriminately. Then some people say, oh, once you have a diagnosis of endometriosis, you are not able to conceive. That's also a myth. We know that it's only about 30% to 40% of women with endometriosis who are not able to conceive, because it's not conceived. All right? Another thing is people say that once you have been diagnosed with infertility, that means you can't have children. That's also a myth. Don't forget what the diagnosis of infertility is. It says that you've not been able to conceive in 1 year, and that is done from statistics. We've seen that if there is no problem at all, if 100 couples try to conceive in 1 year, about 85% of them will conceive. Another 5 to 10%, that 5 to 10% of women also will still conceive in the second year. And that's why we say no matter how old you are, if you have been trying for over 2 years, then you must be doing something about your infertility. Another myth is that people say that weight has nothing to do with infertility. After all, some fat women get pregnant. I'm sorry, please forgive my French. Now, weight has a lot to do with infertility, but it's the two extremes. When you are underweight, it will affect your fertility. And this is usually what happens with gymnasts, with people who do a lot of very rigorous exercises. And then the other side is when you're obese, because your body tends to, the fat tends to secrete a kind of hormone that confuses the part of the brain that regulates ovulation. So weight has everything to do with the ability to conceive. And another thing is that people say lifestyle also has nothing to do with infertility. This is also a myth. Lifestyle has a lot to do with infertility. And one thing about lifestyle is that is probably, so smoking affects fertility, especially in both men and women, but especially in women. Egg quality is reduced. It increases egg quality, it reduces egg quality by like about 10 years. So many studies have shown that. So a 25-year-old, the eggs are like 35. A 35 is like 45. So, but the good thing about this is that it's reversible also. Once you stop smoking, we've seen that so many times, and the egg quality tends to get better. Coffee, excessive coffee intake can affect your ability to procreate. Alcohol can affect your ability to procreate. Of course, hard drugs, no. All these things that are going around us now, people drinking all kinds of stuff, cough syrup, and all these kind of things, they have profound effect on your fertility. So it's very important for us to, well, maybe I'll just end with this one, and then we just talk a little bit about International Women's Day. And then one thing is about position at intercourse. People believe that the way there is a particular position at intercourse that promotes fertility. Well, that's not very true, because what happens at the intercourse is that semen is deposited into the vagina. Now, semen contains sperm. Sperms are living cells. They can move. And therefore, no matter the position, once they've been deposited in the vagina, they can move to where, if everything is okay, they can move to where they're supposed to move to. So you are pregnant. And even what I tell people, especially after IVF, is that women just like to, I think that's dying now. They want to put their legs up in a particular position, as if the embryo can drop off. Yeah, I'm sorry to tell you that the embryos can't drop off, because your uterus is not affect whether you get pregnant or you do not get pregnant. So I hope you've been able to learn one or two things on today being your special day, and especially the fact that you know that you, as women, are not responsible for infertility alone, that we also contribute our own part to infertility. So women should no longer bear the cross of infertility all alone. It's something that it takes two to tango, and it's a family affair. So, and also some men who, when they're faced with infertility, they don't even follow their women to the clinics. They say it's your problem, go and solve it. I'm sure that is decreasing now, but wherever it's still existing, I think men like that, need to repent. It's on this note that for um, each for equality. So yeah, on this note, I end